monoclonal antibodies are antibodies that are made in a lab, and they're really just carbon copies of antibodies that people make who've survived COVID-19, then in a lab have been found to work really well at neutralizing the virus, meaning these antibodies are super good at connecting to the virus, not letting it enter our cells or doing its dirty work. So we could copy those antibodies, infuse it into people or give it to people, and that gives them a kickstart against the virus before their own immune systems are able to react to the infection. So we're not talking about a transfusion. The difference between this and, let's say, convalescent plasma or a blood transfusion is nothing is coming directly from another person into the patient who's getting a monoclonal. These are monoclonal antibodies that are created in a lab, fabricated, if you will. So nothing's coming from one person to another. This is just taking the blueprint that was obtained from looking at some monoclonal antibodies from people who made a great response to COVID and copying them, creating them, and then infusing them into people who need it. There are 3 products out right now, 3 monoclonal antibodies that people can get in the United States. There are 3 different agents made by 3 different companies. Really using right now one called CASI-IMD, mostly because it covers different variants, including the Delta variant. And this is either given by IV or subcutaneously under the skin. Right now, the FDA has authorized monoclonal antibody treatment to people who are 12 years of age or older, who are at risk of progressing with their COVID-19 to more severe COVID-19 disease, and who have symptoms of COVID-19. So people may feel, well, why do I need to get a vaccine if I could just get monoclonal antibodies if I get COVID-19? And I would say, then you wouldn't really need a smoke alarm if you have a sprinkler system in your house, right? Because why would you need to know if there's a fire? Just let the sprinkler do the job and make everything wet. So you don't want to cross that line. You don't want the bad thing to happen. The vaccine prevents you from ever needing something like a monoclonal antibody. And antibodies, monoclonal antibodies, they're not perfect. They reduce the risk of people getting sicker. They reduce the risk of people getting in the hospital, and they reduce the risk of people dying, but not 100%. So the best way to prevent getting sick and getting hospitalized and even dying from COVID-19 right now is to get vaccinated. Payment for the treatment or the cost of the treatment right now for monoclonal antibodies is borne by us, the taxpayers. So here in the United States, the government has bought the monoclonal antibodies that we are using now commonly. There is one product, Sotro, that is not supported by the government that could be purchased, but that has not been widespread in its use. Most hospitals and clinics now are using this CASI-IMD or BAM-ETI, 2 different cocktails of monoclonal antibodies. So there's no cost for the medicine. Now, infusion of the products could be billed, the cost for that, to an insurance company, but I am unaware of any individual patient that has ever had to pay anything for getting a monoclonal antibody therapy for COVID-19. So where to get monoclonal antibody treatment? There's different places that offer infusions or even injections of monoclonals. This could be hospital systems, it could be health departments. There are public health sites that have been set up specifically in many states to provide monoclonal antibody therapy. One place that you could get a sense of where these are available is by going to a website, www.combatcovid, that's one word, combatcovid.hhs.gov. And then you'll find out about treatments, and then there's a map where you can look, and there's blue dots representing any place that has ever ordered a supply of monoclonal antibody. Some of those places are open for giving infusions to those who have COVID-19.